If your toenails have turned yellow, the first thing most people do is assume it's fungus, and either ignore it, try an over-the-counter remedy that doesn't work, or feel quietly embarrassed about it. That assumption is understandable. Nail fungus is genuinely common, particularly after 60, and yellow nails are one of its most recognizable signs. But here's what often goes unaddressed. Fungus is not the only reason toenails turn yellow. And some of the other causes, the ones that look almost identical, respond poorly to antifungal treatment because they have nothing to do with fungal infection at all. That matters for two reasons. First, antifungal treatment for nails is lengthy, not inexpensive, and not without its own considerations. Starting it without confirming the cause can mean months of treatment for a problem that wasn't fungal to begin with. Second, some of the non-fungal causes of yellow toenails point toward systemic changes in circulation, in breathing, in the lymphatic system, or in how the body handles certain medications that are worth knowing about. In this video, we'll go through 5 possible causes of yellow toenails beyond fungus, what each one looks like, why it happens, how to tell the patterns apart, and when the color of a toenail becomes useful information to bring to a physician. One of these 5 causes is particularly relevant for people managing multiple medications, and it's one that almost never comes up in a conversation about nail color. We'll get to that. First, let's establish what the nail is actually telling you when it turns yellow. The normal pinkish color of a healthy nail comes from the blood supply in the nail bed, the soft tissue the nail plate rests on. Light passes through the translucent nail plate and reflects the color of that vascular tissue beneath. When the nail plate thickens, separates from the bed, or the nail bed itself changes, that pink translucency is altered. Yellow in a nail can come from several directions. The nail plate itself can become thickened and opaque, filtering out the pink and creating a yellow-white appearance. The nail can separate from the bed, creating an air gap that reads as white or yellow. Pigment from an external source, certain medications moving through the bloodstream, can deposit in the nail tissue as it grows. Or the nail bed's own blood supply and tissue character can shift, changing what shows through. Think of the nail as a window. In perfect condition, it's clear and lets you see through it easily. When the glass thickens, fogs, or the wall behind it changes color, what you see from the outside changes too. The question is, which part of the window has changed, and why? With that foundation in place, let's look at the 5 causes. Cause 1. Fungal nail infection, but confirm before treating. Let's begin here because this is what most people assume, and the assumption isn't wrong as a starting point, it's just incomplete. Onychomycosis, the medical term for fungal infection of the nail, is significantly more common in older adults than in younger ones. The reasons are practical. Circulation to the feet tends to be reduced with age, the immune system becomes somewhat less responsive, the nails grow more slowly and are thus exposed for longer, and accumulated years of shoe wearing and minor foot trauma create more opportunity for fungi to gain a foothold. The typical pattern. Yellowing begins at the tip or at one edge of the nail, then progresses slowly toward the base. The nail thickens. It may become brittle or crumbly at the edges. In more advanced cases, the nail lifts from the nail bed, debris accumulates underneath, and the nail develops an irregular, distorted surface. It tends to affect toenails far more than fingernails, and it often affects multiple nails over time, usually starting with 1 or 2. The reason this section exists, even though it seems obvious. Fungal nail infection should ideally be confirmed before being treated, not assumed. A physician can take a sample of nail material and send it for laboratory analysis. This matters because the treatments used for nail fungus, particularly oral antifungal medications, have considerations of their own, including interactions with other medications and requirements for periodic monitoring in some people. Treating a non-fungal cause with antifungals will not work and may delay identifying the actual cause. If you've used over-the-counter antifungal products for several months without any visible improvement, that lack of response is itself informative. It may mean the cause isn't fungal, or it may mean the infection requires prescription-strength treatment. Either way, it's time to bring it to a physician rather than continuing the same approach. Cause 2. Nail psoriasis. Psoriasis is widely known as a skin condition, patches of thickened, scaly, inflamed skin, most commonly on the elbows, knees, and scalp. What is less commonly known is that psoriasis frequently affects the nails, and it can do so even in people whose skin involvement is mild or not obvious. Nail psoriasis produces changes that can look strikingly similar to fungal infection: yellowing, thickening, separation of the nail from the nail bed, and irregular nail surface. This resemblance is part of why the two conditions are so often confused. The distinction lies in the details. Psoriasis of the nail often produces small pits, tiny indentations on the nail surface, like the surface of a thimble, that fungal infection typically does not. It can also cause a phenomenon called the oil spot sign, or salmon patch, a yellowish-orange discoloration visible through the nail plate, as though a small drop of oil has been trapped under the nail. The nail separation in psoriasis tends to have a particular margin, a thin, reddish-brown border around the separated area, that differs from the more diffuse separation seen in fungal infection. Here's why this distinction matters practically. Antifungal medication has no effect on nail psoriasis. Treating psoriatic nail changes requires an entirely different approach, and the right approach depends on whether psoriasis is affecting other parts of the body, how much the nail involvement is bothering you, and what other treatments you may already be using. A dermatologist is typically the appropriate specialist for this evaluation. If you have a known diagnosis of psoriasis elsewhere on your body and are now noticing nail changes, tell your doctor. The connection is direct, and the information is clinically useful. Now let's look at a cause that operates through a completely different mechanism, one involving the body's drainage system. Cause 3. Yellow nail syndrome. This is the rarest of the 5 causes on this list, but it is medically significant enough to include, and specific enough in its presentation, that recognizing the pattern matters. Yellow nail syndrome is a condition in which the nails become uniformly yellow, or pale yellow-green, grow unusually slowly, thicken, and develop a curved or overcurved shape. The surface may become smooth and glossy in a way that looks almost polished. In some cases, the nails partially or fully separate from the nail bed. What makes yellow nail syndrome different from the other causes is what accompanies it in some people. The condition has been associated with changes in the lymphatic system, the body's fluid drainage network, which can produce swelling of the legs or ankles. It has also been associated in some people with respiratory conditions, including recurrent bronchitis, pleural effusion, fluid around the lung, or other chronic lung issues. The mechanism is not fully established. The current understanding is that impaired lymphatic drainage may affect nutrient and fluid delivery to the nail matrix, slowing growth and altering appearance. But this association is not universal. Some people have nail changes consistent with yellow nail syndrome without obvious lymphatic or lung involvement. The key pattern that distinguishes yellow nail syndrome from fungal infection: the yellowing is uniform across the entire nail, not starting at the tip. Growth is noticeably slower than other nails. The texture is smooth and curved rather than crumbly and irregular. And crucially, if the same person also has persistent leg swelling or a chronic respiratory condition, the combination of findings is what prompts investigation. Yellow nail syndrome is diagnosed clinically. There is no single test for it, and management is tailored to the individual, particularly addressing any associated conditions that are identified. If this pattern resonates with you, the appropriate question to raise with your physician is not just about the nail color, but about whether any accompanying symptoms might be connected. Before we move to the final 2 causes, which are worth knowing about and easier to address than the ones discussed so far, which of these patterns sounds most familiar to what you're seeing? Leave a comment if you've already been told it's fungus but the treatment hasn't worked. That's one of the most common patterns in this whole topic. Cause 4. Medication-induced nail changes. This is the cause that almost never comes up in conversations about nail color, and it's particularly relevant for people who are managing multiple health conditions and taking several medications daily. Certain medications can alter the appearance of nails as a side effect, and yellow discoloration is among the changes that can occur. The mechanism varies by drug class. Some medications affect circulation to the nail bed. Some alter the structure of the keratin, the protein that makes up the nail plate, as it's being formed in the nail matrix. Some create a photosensitivity reaction, in which the combination of the drug and sun exposure damages the nail tissue. One class worth knowing about: tetracycline antibiotics, including doxycycline, which is used long-term for conditions including acne and rosacea, can in some people cause nail discoloration and nail separation, particularly in areas exposed to sunlight. This is called photo-onychomycosis, sun-related nail lifting, and the discoloration can include yellow tones. Certain anti-malarial medications have been associated with nail pigment changes. Some chemotherapy agents can affect nail color and texture during treatment. Some cardiovascular medications have been reported in association with nail changes in individual cases, though this is less consistently established. The practical point is this: if your toenails began yellowing or changing around the same time you started a new medication, or around the same time a dose was increased, that timing is worth noting and raising with your prescribing physician. Do not stop any medication on your own based on a nail change. But the correlation is useful information. Bring your full medication list to your next appointment, including over-the-counter products and supplements. Mention when the nail changes began and whether the timing corresponded to any medication change. This is exactly the kind of information that a short appointment might not naturally surface unless you raise it. Cause 5. Reduced peripheral circulation. The final cause on this list connects nail color to something larger: the health of the blood vessels supplying the feet and lower legs. Adequate circulation is essential for nail health. The nail matrix, the growing region at the nail's base, requires a steady supply of oxygen and nutrients delivered by small blood vessels. The nail bed itself is richly vascular. When that blood supply is compromised, the nail can show it. Peripheral artery disease, narrowing of the arteries that supply blood to the legs and feet, is more common in older adults, and particularly in those with diabetes, high blood pressure, a history of smoking, or elevated cholesterol. When circulation to the feet is reduced, the consequences can include slow-growing, thickened, discolored toenails that may take on a yellow or dull yellowish-brown appearance. The nails may also become harder and more difficult to cut. Here's the distinction that matters. Circulation-related nail changes are typically accompanied by other signs in the feet and legs that a physician would recognize. The skin on the lower legs may be thin, dry, or hairless in areas where it normally would not be. The feet may feel cooler than expected. There may be a history of cramping in the calves during walking that resolves with rest. This is called claudication, and it is a recognized sign of reduced arterial flow. Wounds on the feet that heal slowly are another associated sign. Nail changes in isolation are not enough to diagnose peripheral artery disease. That requires clinical assessment and, when indicated, specific testing. But if you are experiencing yellowed, slow-growing toenails alongside any of the accompanying signs just described, the conversation with your doctor should go beyond the nail itself. That distinction changes the direction of the evaluation entirely. A nail that is changing because of reduced circulation needs circulatory assessment, not antifungal treatment. Here is a straightforward framework for moving from awareness to action. Step 1. Look carefully at the pattern, not just the color. Does the yellowing start at the tip and spread toward the base, more typical of fungal infection? Is it uniform across the whole nail, smooth and curved, more consistent with yellow nail syndrome? Are there small pits on the surface or an oil spot discoloration, pointing toward psoriasis? Is the nail crumbly and thickened or smooth and slow-growing? These distinctions guide the conversation you have with a physician far more effectively than simply reporting, "My toenails are yellow." Step 2. Note the timeline. When did you first notice the change? Did it start gradually in one nail and spread? Did it appear around the time you started a new medication? Has it been present for years without changing, or has it progressed recently? Timeline is one of the most useful pieces of information in determining cause, and it's something only you can provide. Step 3. Note what else is happening in the surrounding area. Are your legs or ankles swollen? Do your feet feel cold compared to your hands? Has skin on your lower legs become unusually thin or dry? Have you had any respiratory symptoms? persistent cough, breathlessness, or chest infections that seem unrelated but are ongoing? These accompanying signs are the context that turns a nail observation into a clinically meaningful picture. Step 4. Ask specifically for confirmation before accepting treatment. If a physician recommends antifungal treatment, it is entirely appropriate to ask whether a laboratory sample will be taken to confirm the diagnosis before treatment begins. This is not an unusual request. It is clinically sound practice. Nail fungus can be confirmed with a sample sent to a lab, and that confirmation protects you from weeks or months of treatment that may not address the actual cause. Yellow toenails are common after 60, but common doesn't mean simple, and it doesn't mean the cause is always the same. Fungal infection is real and worth treating when confirmed. But so is nail psoriasis, which requires a different approach. So is the medication your body has been processing for years, which no antifungal will touch. So is reduced circulation, which points to a conversation about vascular health rather than a trip to the pharmacy. The central point of this video is not to alarm you about your toenails. It is to give you a more accurate picture of what might be happening, and to help you have a more specific, more useful conversation with your doctor than, "My toenails are yellow. Is it fungus?" Better questions lead to better answers, and better answers lead to the right treatment rather than the assumed one. If this video helped clarify something you've been wondering about, share it with someone who's been living with this question quietly. Nail changes are easy to feel self-conscious about and easy to postpone addressing, but they don't always need to be either. In the next video, we'll look at what skin and hair changes can tell you about the same underlying systems: circulation, nutrition, thyroid function, and medication effects, and why these three visible markers often change together when something systemic is shifting. What the body shows on the outside is often a reflection of what's happening within. The question is whether you know how to read it.